Dr. Kourakin, I would like to talk to you about orthodontic work. I know you see children, you have a true family practice there. And in terms of orthodontic work, I would like to point out Invisalign, or the type of Invisalign, invisible braces. Shed some light on it, of the advantages those braces, that type of procedure has.
The beauty of the Invisalign procedure is the fact that the patient does have some control and some option as to when they wear the appliance. If there's a point where they absolutely cannot wear the appliance, let's say a child is in a stage performance, for instance, they can remove the appliance, they can do their performance, and then they reinsert the appliance and they go about their life. So that's one very nice advantage there. Individuals there, adults, for instance, who for cosmetic reasons do not want to show braces, or may find themselves in a position where speech may be an issue. Once again, they can remove their appliance and they can perform whatever they need to perform and then go back to the appliance, and nothing has been lost. Tooth movement will continue on. The other advantage is the fact that we can stabilize the teeth. We can hold that position for any length of time without there being any kind of irritation to the inner lips and to the tongue. Some people have a tendency to play with conventional braces, and they will lacerate the cheeks and they'll lacerate the tongue. So once again, it's just a little bit more comfortable way. But once again, we need to assess the individual to see whether they would be a candidate for that type of a treatment.
Right. So there are still some situations in terms of how the teeth are arranged and how crooked they are and where they are crooked, where sometimes this Invisalign, which is basically a mouth guard, right? It's two mouth guards, basically. You put them on and you wear them all the time, or almost all the time, as you mentioned. But sometimes that might not work out, and a person has to go back to the traditional braces. Is that what you're saying?
That is correct, Helmut. There are cases there that you have no choice because of how teeth need to be moved and the forces that are necessary to bodily move a whole tooth. That's something that sometimes is extremely difficult to achieve with Invisalign. It can be done, but you have to weigh the pros and cons of both techniques.
And of course, a trained dentist like you will know that and will inform the patient of the better option. Now, question. So you have those trays, and there are, I don't know, 20 of them or whatever throughout the whole procedure. So what about if this teenager, because you take them out for eating, which seems to be a big advantage, that you can brush and floss your teeth afterwards, where with regular braces, again, the flossing and brushing becomes difficult. The wire serves as a flak or for the spinach, and it's all rather cumbersome. In fact, I have heard that some people, after a couple of years of braces, their teeth are straight, but they now have gum disease, and you have mentioned what a disaster that would be. Is that true?
Absolutely. One of the saddest cases that I had seen was a young man who was from a family that was extremely dentally conscientious, but unfortunately he wasn't. And when his braces were removed, we found 27 cavities in his mouth. Now, can you imagine 27 cavities? That's almost a cavity per tooth, and actually it was many cavities in some teeth there. It was a disaster. Gums being severely inflamed. We've seen some horrific cases there where patients would interrupt their orthodontic treatment because of finances, or they've moved and now they need to find another orthodontist, and they've left the braces on. And they haven't done the maintenance with the braces there. So we've seen some really sad things occur to individuals' mouths. And sometimes we've had cases walk into our office where we literally had to undo the braces and literally take care of the teeth before they could actually go further with any orthodontic work.
Yeah, that's obviously not good. Now, obviously, that person contributes to this by, being negligent in the brushing. But as you mentioned in other areas, well, sometimes we are, and men and boys and all that. And so if you can avoid it, why not try avoid it? So anyway, so this Invisalign type of braces avoids that, because you take them off, you brush them, and you even said if a person is very conscious and thinks that for this one afternoon or this one evening he doesn't want to wear them, it's not the end of all, as long as I guess he doesn't get used to wearing them only a little bit. Now, what about if you lose one of those? Again, you have that 16-year-old boy or girl, lunch, taking off, and then he chases that other 16-year-old boy or girl and forgets all about braces. I mean, we can think with that, right? What then?
Well, that's actually the biggest problem with any removable appliance, whether it's an Invisalign, a retainer, and God knows how many retainers are lost. They're like socks in a dryer. I don't know where they go, but they just disappear. And it's always the sad phone call, the angry parent. Billy left his retainer. Billy left his Invisalign at McDonald's and was thrown into the trash. And we need to find another one. So here we are, and we take some impressions, and then we create another appliance there. And depending on the child, sometimes if a child is very negligent and they lose 2 or 3 or 4 appliances, and there have been that many kids that have lost that many appliances, sometimes we need to actually charge for an additional appliance. So we coach them and we explain to them how critical it is to hold on to your appliances.
Got it. But what you're telling me here is if that kid loses, one here and one there, it's not even an extra charge.
That is correct.
Beautiful. Now, what about the child who is a little bit, shall we say, not quite honest about wearing them or not wearing them? How can you monitor that? What?
We'll know if they're wearing them or not wearing them.
Well, you know it because their teeth are not straightening out, right? But then the kid says, I wear them. Mom believes the kid. You say, well, your teeth are not straightening. Mom says, hey, your dentistry stuff doesn't work. I mean, do you have any other way of checking that? Any compliance?
Very much so. Stone models are archival. In other words, we take the impressions, we make a model of the mouth, and we can take the appliance and we can seed it onto a stone model, and graphically, visually, we can show the patient, we can show the parent, this is what's happening. And so there's really not much argument there.
Mm-hmm. Do you see lots of non-compliance, or is that, relatively okay? And when you talk to the parent / to the child, do you put that into consideration and say, look, Mrs. Schmidt, maybe your son should wear some real ones, because I don't think he's going to wear them. I mean, are you making that assessment?
Absolutely. You need to make that assessment all the time. A patient really needs to want the Invisalign, and there's got to be good reason for them to want the Invisalign. If I have any doubt about their compliance, and we warn them that treatment may be extended far longer than if they were compliant there. So there's a drawback to them not being compliant.
Right. All right. Now let's go a little bit to adults. Some adults, and they may have a couple, 2, 3 crooked teeth in front of them, whatever it might be, not too much crooked. So they have a choice. They can put veneers and lumineers on it, which you talked in great lengths, and it's like bang. They, couple visits and they're out and done. But some might say, I don't like that invasive things. I really like my teeth. They're just a little crooked. And I hear that there's a lots of adults these days going for this Invisalign braces, and that it doesn't sometimes take all that long. Sometimes it takes 3-6 months because there's really not so much to fix. Is that kind of the case, and should adults put that into consideration?
Well, once again, depends on the complexity of the case, depending on how much tooth movement is necessary. Sometimes to gain tooth movement, we actually have to sand or strip the teeth to allow the teeth to move into position there. So we actually have to take a device that will actually sand down the tooth between the teeth, and in doing so, we may actually remove as much enamel as what we would do if we were to do a veneer, for instance. So we really have to look at the case very critically, lay out a blueprint, lay out a plan as to what would be the pros and cons of both technique and both methods there, and decide which is going to be the least invasive procedure for the patient. It takes a little bit of study, and we do that for our patients.
Yeah, is it true that the adult orthodontic treatments, meaning adults who do take orthodontic treatment, has drastically increased over the last half a decade or so?
Absolutely has increased. I just heard the other day, it was not one of my patients, but it was one of my patient's sisters who at age 70 decided to have braces done because she was tired of having crooked teeth, and before she passed away, she wanted to have a nice straight smile. That's one of the oldest patients that I have seen or have heard of to have had some sort of orthodontic correction there.
Right.
And I give her credit. But we have to remember just one thing, a critical factor. In adult orthodontics, slow movement of the teeth is absolutely critical. You cannot accelerate the movement there. Adults may be impatient. They may want the case finished quickly. If you do that, you are asking for trouble. And I repeat that. You are asking for trouble. Teeth need to be moved slowly because you can create bone defects. We can create defects in the roots of the teeth. And you can create more problems than you ever would have dreamed of if the teeth are moved too quickly. So please do not insist to your orthodontist to move teeth too quickly. They must be slowly moved.
So a person who is a little bit on the impatient side, he at that point probably would be better off with veneers, lumineers, and crowns and bridges or whatever. Crowns, veneers, yeah?
Absolutely. There's no question about that.
Well, all right. Good insights. Thank you very much, Dr. Kourakin.